We're now live on YouTube. So I will pass it on to Samiksha ma'am. Yeah.
On behalf of Global South Coalition for Dignified Menstruation, I warmly welcome you all on today's webinar titled The Power of Media in Advancing Dignified Menstruation. First of all, I want to thank all of you for joining us here today and those who are here with us over Zoom, and we also have live. So, offer all of you again, heartily welcome from all of us. And I believe today's session is very timely, and I also believe that it's going to be a thought provoking conversation. Well, we all are aware that media plays a powerful role when it comes to shaping public understanding, influencing social norms, and also driving change. The stories we tell through media or even news media, and also the stories that we decide not to tell, I believe that it can reinforce stereotypes, or it can also challenge stereotypes by the angle we pick up, by the issue we pick up. And I believe there is a direct connection when it comes to promoting gender equality. When it comes to menstruation, the media, we all know like it has an important role to play. Yet, in my own experience as a news media researcher, I strongly feel that there is so much of work that we need to do to see the kind of the media or to see the kind of news reports so that they are accurate, they are ethical, inclusive, and more importantly, centered around dignified menstruation. Today, we are privileged to joined by Mr. Derek Onzere, a communications and development practitioner and also a journalist from Kenya. With his extensive experience in journalism and strategic communications, he has worked on a range of development issues and is passionate about using media as a catalyst for social change. We at the Global South Coalition for Dignified Menstruation are delighted to have him with us today to share his insights on how media professionals can help transform the conversation around menstruation. Derek, thank you so much for accepting the invitation. It is a pleasure to have you with us. So, before we begin our discussion, I would like to briefly introduce yourself in case I have left out something. And can you also tell us about your journey in communications, or basically what inspired you in this important conversation before we get into specific questions? Derek, can you hear me?
Okay.
Yes, yes,
Pleasure,
let's get started.
pleasure, Samiksha. Hope everyone is getting me clear.
Yes.
Okay, thank you so much.
So,
I
Derek,
take
is it
this
also
also.
possible to see you? Can you switch on the camera if it's all right?
Okay, you're not seeing me? I thought I'd switched it on earlier
Can you
on.
try switching it off and switching it on? I can see the backdrop, but I can't see you. I don't know if it's my problem or it is everybody's problem.
Yeah.
Sir
Even
Vikachi,
even
can you
even
help
I,
us?
I even I cannot see Derek. Just the backdrop.
You
Okay,
can't see
Derek.
me?
No, just the backdrop, Derek.
Just a little bit, yeah.
Yeah,
Maybe
it,
the anti-light.
Check.
Sometimes it anti-light does that with the backdrop.
and as Derek fixes
Yeah.
the issue, I also would like to take the time. First of all, we'll engage in conversation directly with him, and for all our participants, the one who have joined us, please feel free to ask questions. So we want to make it interactive. For the last 10-15 minutes of this 1 hour session, we will be having questions. So please keep your questions ready for Mr. Derek. And whenever possible, I'll also try to chip in and share my opinion, what I feel about. as I'm extremely passionate about this issue, and we have been working together with Global South Coalition for Dignified Menstruation from 2020. And looking back, I think we have definitely achieved different milestones, but there is still a lot of work to do. So we are still lobbying, we are working hard. And I believe like interactions like this, conversations like this is definitely a stepping stone when it comes to mainstreaming dignified menstruation in media and also in other avenues. Derek, are we making
You able to
progress?
see me now?
Not yet.
You able to see
Can
me?
you
Not
try
yet.
removing the background? Maybe it's the backdrop. If you try removing the
Oh,
backdrop from video
Yeah.
settings.
okay, okay.
Yeah. Technology helps us and always sometimes it makes our life difficult as well. So it's okay. Take your time, please.
It's okay, it's okay. Video. Are you able now
Oh,
or
not
still
yet.
yet?
You can see me, right, Derek? You can see me?
Yes, I can see you.
Okay. But
Can you
can
able
you
to see me?
not yet, not yet. I can see the backdrop only. So if you go to the video
I
setting,
remove the
perhaps
back.
if you click on the video
Yes,
and go to video and effect settings,
yes,
and on the virtual background, you can click none. If you
yes,
click, okay, so it should, you did it, right?
yes. Now are you able?
I still see the backdrop. That's surprising because I was trying to remove the backdrop thinking it's gonna help. Okay, so Sarmila ji, shall we start without the video? What shall we do? Or
I
shall we take a couple of minutes? I can pause for a while and we can
or
have Derek.
yeah, Lal here is trying to fix
Okay.
I think
video.
Derry has off the camera on the screen.
Yeah, switching off and again turning it on might help sometime.
Mm-mm. It's still
Still similar.
yeah, still the same. One last thing, Derek, can you remove
Can you
can you
slide
just
your
leave
camera
uh,
on the camera button like top of the screen?
top of the screen?
Your camera slider is on, I think. If you can open the slider, you will be visible.
Now are you able to see?
No.
No,
Still
No.
your
Okay.
camera slider is, I think, off. You can
do
go to the
do
camera,
you have
but
cover in your webcam, Derek?
yeah, webcam.
Yes, I have it.
Is it closed or is it open?
It is open. It's open.
Oh, okay. So not that as well.
Maybe signing out the Zoom and signing in again might
Yeah,
help. Oh yeah,
if
rejoining
you
it.
can
Somebody just said that.
yeah, if you can rejoin and
Yeah, yeah, yeah.
one last try
Yeah, let's
and
give a
we
last
will
try. Otherwise, we can just
we
start
can yeah, yeah, just
audio. Yeah,
continue.
yeah,
Yeah.
yeah, yeah. It's conversation that's important.
Yeah, exactly.
Okay. Oh my God.
Derek, we still cannot see you. Can you try? Mm.
Let's wait for 2 more minutes. Otherwise, I think we can just start the conversation with or without the video. Sarmila ji, what do you suggest?
Yep, yep. Lal is communicating with
Okay,
Derek right now.
perfect,
Yes.
perfect.
Let's
Okay.
wait for 2 more minutes.
Tamila, just a little bit. I call
Yeah.
it an expert, just a little bit.
Yes, Derek?
Eric, can you receive my call on WhatsApp? So I will show you the camera.
Hiyo ni ya YouTube. Yeah. Close this one.
Samiksha ji, I think we can start. It's not
Okay,
working.
let's start without the video, both of us. Then I think that will be fair, fair for everybody. Okay, so yes, once again, welcome. Yeah, we have limited time, so I think we should not delay further because everybody's time is important and we equally respect the time of all our participants. And thank you once again. So, Derek, as I was briefly saying, can you briefly introduce yourself and tell us what inspired you as a communication professional to work on this area? Yes, over to you, Derek.
Thank you. Are you able now to get me?
Okay.
Shamil,
Yeah, Derek, we can start.
to get me.
Yeah,
Yeah,
we can hear you,
Okay,
Derek.
thank you so
we
Yeah.
can
much.
hear you. Yeah.
Thank you so much, and sorry for the inconvenience occurring through the video.
No problem. No problem at
But
all.
we can just continue through the audio one. Thank you for this opportunity actually to speak to the Global South Coalition. Actually, it has been an amazing journey meeting you people and for such an awesome conversation around dignified menstruation. Derek is a Kenyan born journalist. Um, Actually, I'm a Kenyan and I live in Kenya. As a media and communications professionals, this has been actually uh, my um has actually been my most amazing journey that I can walk and talk about. Something that really inspired me to find myself advocating for uh, menstruation and dignified menstruation is actually the time that we as journalists go out to the field, because actually I've been working for the Kenyan media, local media houses for about 1 year before I transferred to other agencies and even within other organizations that I've worked in. So whatever really transferred me towards this journey of talking about dignified menstruation, it's all about you as a journalist when you go outside, for example, to source news, you go to gather news outside there, and especially when you go outside in the rural areas, you find that there are so many things, there are so many uh, uh, actually hardships that you find that women, young girls are going through, that the media has not actually highlighted, that has brought them up to the space where we can speak about. So actually, as I was going to gather news one day on time, I met a young, old, not a young, but an old age woman whom she shared with me the problems that she was going through, and actually she linked the problems towards the young daughter she had. Actually, the young daughter, the young girl, had been sent home for school fees, and even just obtaining some cash to buy sanitary towels was really a problem. So that really actually touched my heart as a journalist, and I said that these are the kind of stories that we journalists, we should bring them to light. At least we can shape public perception, public opinion concerning menstruation.
Yes, thank you,
So
Derek.
actually,
Yes, yes, please.
yes.
Yes, thank you. Yeah, I can see and I can understand your perception, and that's definitely powerful. In my opinion, also, like when we talk about news reports in particular, we see a lot of news stories around menstrual pads, just like you mentioned. But when it comes to dignified menstruation, as you have also briefly mentioned, we are trying to look it beyond sanitation, trying to look it beyond hygiene, right? So, in your opinion, why does media matter when we talk about dignified menstruation?
Thank you so much for that question. Actually, when you talk about, for somebody who has gone actually perhaps through the media class, will tell you one of the theories that has been highlighted about the media as an agenda setting, institution in the society, because it is the media that shapes public opinion, public, public perceptions about events or topics that actually really happen to the society, that are happening in the society. So when I say, or when we say that media shapes public opinion, it influences actually what the society considers is important, because the society wants to hear uh, the real issues, the real issues that are
Mm-hmm.
happening around them, so
Mm-hmm.
when menstruation actually is being ignored within such kind of setup or of family, then we see that it is misunderstood, mocked in media, stigma continues. But when journalists tell informed,
Mm-hmm.
evidence-based stories, they help people understand what menstruation is all about, and that menstruation is a normal, biological process that
Mm-hmm.
affects millions of people.
Mm-hmm. Yeah,
Yes,
exactly. And I also feel like when we are trying to talk about dignified menstruation in media, we are just not looking into problems, just like you rightly mentioned. We are also, showing the audience, showing the people, like, okay, if menstrual discrimination is a problem, that perhaps dignified menstruation is the solution. So if we understand menstruation from the eyes of dignity, from dignified menstruation lens, so maybe that would be the right approach. And incorporating dignified menstruation in the news reporting will definitely help us to overcome, just like the stigma you were talking about, just like discriminations that we all are aware about, right? And just to add
exactly.
up again in this question, and even to be more to concentrate it further, what does ethical, accurate, and inclusive reporting on menstruation and menstrual discrimination look like? Or let's say, in your opinion, what do you think are some common pitfalls journalists should avoid while covering the issues on menstruation and menstrual discrimination? What are your thoughts, Derek?
Okay, thank you. When we talk about ethical menstruation or ethical reporting when it comes to menstruation, it is actually a wider area or a broader spectrum that we need to talk about, because actually before the media came up, when we talk about the digital age, there are some things actually journalists have been reporting which are actually not advocating for dignified menstruation. And therefore, when we talk about ethical reporting, actually, as a journalist, ethical reporting should be evidence based, just rather than by driven myth. The journalist should come, the media should come out, explain to the public, explain to the society what is actually dignified menstruation act based on the evidence that they have at hand. Because actually, with media, we go by facts, we go by factual things. Number two, we'll talk about respect to people's dignity and privacy. Because when you talk about, uh, for example, reporting uh, a certain an issue on a menstruation of a young girl, but you're
Mm-hmm.
not taking care, you're not preserving their privacy, their dignity, then it doesn't become a dignified reporting on menstruation. Number three, we talk about inclusive or diverse experiences. The journalist or the media should source out, experts from various fields in the society. They come up together. They now share their different perspectives about dignified menstruation. And therefore, when we talk of pitfalls that journalists have found themselves in, when we talk of even of today, you find that most journalists are focusing only on shocking stories without describing, or discussing the solutions. because it is not of much importance or of benefit when we say that girls are lacking pads. Girls have not been taught about how to use sanitary towels, but we are not providing the solutions, and therefore you find it
Mm-hmm.
difficult to
Yeah.
find ourselves. We are moving from one point to another or from one state to another. Another thing, uh, journalists actually treat menstruation solely as a women issue, excluding
Mm-hmm, mm-hmm.
the transgender. They don't involve men in this issue. They don't involve boys, and you find that
Mm.
sometimes back. That is what I've really been trying to advocate including, making men engage in such kind of conversations. It really makes it to look like it is not a normal thing. We can really help our
True, true.
girls. We can really help our women. Yes,
Wonderful, definitely very enlightening. And also, like just like you rightly pointed out, simple picking up the terminology, it also matters. Like even calling menstruation menstruation rather than just calling it period, the choice of terminology also matters. And rather calling men and women, picking up menstruators and non-menstruators. And also you're stressing over like, yeah, we are not including transgender community, right? Because when there are menstruators in transgender community, it's important we acknowledge it, and it is not just the women issues, it is also men's issues. And I really like your opinion there. And when it comes
exactly.
to reporting, I also feel that in my personal experience, menstruation as a topic, first of all, it is overlooked, and too often people are spoken about rather than spoken with. So we are not giving
Exactly.
any agency to the menstruators. So yeah, when it comes to meaningful and accurate coverage, I think centering the stories around these lived experiences, just like you mentioned, and also very important point, respecting privacy, respecting individual voices, and give those. So I think that way we can set proper narrative, and that's what dignified menstruation is also all about. So moving on, this is definitely very interesting conversation. I definitely want to know more. Like we mentioned in the beginning of this webinar, media stories, they shape how people think and talk about menstruation, right? Right from seeing the advertisement while growing up, right from reading the news stories in our newspapers, it is shaping us knowingly or unknowingly. So, how can journalists move beyond this stigma, stereotypes, and there is a lot of sensationalism when it comes to stories around menstruation, menstrual discriminations. So, how can we leave these things behind and move our stories or make our stories respectful, empowering, and human centered? What are your thoughts, Derek?
Okay. Thank you so much. I like your inputs and your insights about that one. That actually good journalism should move beyond awareness and accountability. And when we talk about the media stories that actually shape how people think and how people talk about menstruation, what I can say is that journalists should start centering people rather than stereotyping. Like when we talk about, instead of asking, how is this story shocking, who's experiencing this, and what systems contribute to these challenges. And therefore, we say that good storytelling focuses on dignity rather than pity, you know,
Mm-hmm.
shows resilience alongside challenges, includes diverse communities, use of respectful visuals, explain the broader and socio-economic policy context, and therefore,
Mm-hmm.
when we say that shaping solutions, journalism can be particularly effective rather than only highlighting problems. Journalists can also showcase innovations in schools, community programs, policy reforms, grassroots initiative, and they are making and the difference actually they are making. So when you say about this, we talk about reporting actually helps audiences empathize, rather than judging, about what menstruation is. And
Hmm.
therefore, for me, in my opinion, I can say that actually journalists should, or the media at large, should go beyond uh, human centering, but uh, actually showcase resilience alongside the challenges that women are going through or young girls are going through.
Yeah, and yeah, just to highlight on what you just stated, when it comes to representing menstruators, we are often representing them as victims rather than as survivors, just like you rightly pointed out. The degree of empowerment, or I like the word, like the term you used, resilience, right? We haven't used that, how far we have come, how much of arguments, how much of pursuing, how much, what sort of
Biblia
uh,
imekataa kufanya.
challenges we are overcoming. It is not just within our official setup, professional setup, but we have to start these arguments with our parents, with our teachers. And yeah, it is. And when we have to start these arguments in home, I think it's actually more difficult. Just to tell your dad, whom you think knows everything, you need to tell your dad, like, what you are telling is not right, this is wrong. Menstruation is a biological process, and it has got nothing to do with religion, cultural beliefs, right? So yeah, so resilience is definitely what we see missing when it comes to coverage, when we see the coverage globally as well as locally. So I am particularly very interested on this part of media representations, right? So I can't help but ask you, whose voices and experiences are often missing from media coverage on menstruation in your local context, in Kenyan context, for this for today, and how do you compare it with global representations, the way it is covered by BBC, Guardian, or big media houses? Over to you, Derek.
Thank you so much. The voices, being
Mm-hmm.
field, of media and communication. In Kenya, actually, media coverage has been over time focused on schoolgirls, period poverty, which is important, but only part of it, which forms just part of the society. But we have not talked about the broader spectrum when it comes to dignified menstruation. The voices that over time that I've learned they are missing actually in the Kenya media coverage. You know, I've never seen, or in little have I seen the media talking about women and girls living with disability. That's number one. Women and girls with disability. Most of the time, the media has not been highlighting whatever they are going through, when it comes to dignified menstruation. You find that most these young girls or women have disability. You find that most of them are being hide from the public. They are hidden from the public, and you find that they are not exposed to such kind of uh, sensitization, such a kind of education, such kind of exposure when it comes to dignified menstruation. Because tell me, like a person who is disabled and has been locked at home, you
Mm-hmm.
know, she or he may be going through a lot, but
Right.
because nobody is talking about this, you find that this kind of person, this kind of individual is suffering a lot, and therefore that's the area that I see that this is the voice that has been missing in the Kenya media landscape over.
And yeah,
Another
yeah, sorry, good,
voice
carry on.
that's really missing that has been,
Yeah,
yes,
carry on. Sorry. I
yes,
thought
just
I thought you
continue.
ended. So yeah, yeah.
Thank you. Like when you talk about refugee,
Mhm,
like right now, being bordered by other countries who they are facing civil wars, they are facing political conflicts, and you find that they are they become refugees in our country, um, and they become displaced. Most of them, when you talk about war in South Sudan, for example,
mhm,
that's our neighbor there. You find that these refugees, because they are on constant move, they are on constant walk, finding uh, these uh, items, is really difficult. Finding water, finding good washrooms, good toilets, finding sanitary towels, it becomes a challenge. And mostly, or most of the time, the media has been talking about food for refugees. They have been talking about shelter. But when it comes to dignified menstruation, I think this has been something that has been really forgotten. Another thing is pastoralists are the same. When you talk in Kenya, like the northern part of our country, you find that the communities that are living there, they are pastoralists. Every time now and then they move even out of the country, go in search for water and pasture because of climate change. You find that the northeastern part of country is arid and semi-arid, and you find that sometimes uh, we are faced with drought, and you find that these communities, they are actually moving, they're on constant move, and therefore um, when it comes to dignified menstruation, when it comes to their voice, actually it is really missing within the media landscape and in the Kenyan context. As earlier as I had talked about the men and boys, whose understanding actually will help reduce the stigma. Earlier on, boys had been left, men had been left, uh, in this conversation about dignified menstruation. But of recent, I see they have started coming out. Now men they are really participating in initiatives that actually drive dignified menstruation. They are advocating for policy they are driving this conversation. But when you talk about their voices, actually, they had really been left out, when it comes to menstruation. Uh, and therefore, when I really, for example, uh, compare Kenya globally,
mhm,
there has been actually progress toward more diverse storytelling, but many international narrative still focus heavily on product access. Like in Kenya, when you talk about menstruation, you'll hear most people telling you about
mhm,
sanitary towels. The conversation just revolves about sanitary towels, but it's not about sanitary towels only. The conversation, actually, when you talk about globally from the Kenyan perspective, it
mhm,
increasingly expanding to include menstrual pain, workplace rights, environmental
mhm,
sustainability, menstrual justice, uh, all those kind of conversation. And therefore, as a Kenyan media practitioner and a journalist, I can say Kenya media has an opportunity to tell more locally grounded stories that reflects the country diversity while connecting them to the broader global conversations about uh, menstruation. Back to you.
Wonderful.
Yes,
Yes, please. Thank you very much. Thank you very much, Derek, for that, especially for touching upon a very important topic, menstruation during emergencies, right? In the crisis situation, something that is very important to
yes,
talk about. And I'm very happy to listen to your thoughts. And at the same time, like it's very saddening that there is so much of work that we need to do, right? So what is like just like we say the light at the end of the tunnel, the good thing about a dignified menstruation is this is a human rights framework. It challenges lifelong menstrual discrimination. It also helps to dismantle patriarchal power. So when a journalist includes dignified menstruation frame, he or she is also including this holistic framework, just like you talked about, overlooking, hygiene to dignity. That's very important. And overlooking this concept of charity to rights, and from impurity to purity, isn't it? um, before we move
exactly.
before we move forward, I actually have one more question, and I think I'll take a break for a short question and answer, and then we will move on to final question. Is that okay?
It's okay. It's okay.
So, Derek, can you please share example of media coverage or storytelling that have successfully challenged menstrual stigma or contributed to positive social change? And also, in your opinion, what made these stories impactful?
Okay, thank you. I'll start in the Kenyan perspective, in the Kenyan way, that actually in Kenya, investigative reporting on period poverty has helped elevate discussions about access to uh, products, school attendance, and government responsibility. Many local journalists have also highlighted stories from communities where girls miss schools because of inadequate menstrual support, helping shift the issues from clarity to public policy. Uh, the example that I can really share that I've come across over time as a journalist, this example is the Oscar-winning documentary. I don't know if uh, we have come across it. That is titled "Period End of Sentence." I don't know if uh, some of us or all of us have come across. Actually, this documentary, I've watched it, and actually, it has helped bring global attention to menstrual stigma by centering women's voices and showing how economic empowerment and menstrual health are really connected. Uh, it's not about when you talk. It's not about sanitary towels only, but how can we make these products available uh, to the market, available us, available to the society in a more easier way, in a more way that is not costly, in a more way that comprises of women and men together working towards bringing a dignified menstruation. And therefore, um, social media campaigns, in other perspective, have also been influential because they encourage ordinary people to share their own experiences, making menstruation more visible and less taboo. And this is what actually I love doing. Social media campaigns actually has really been favorite thing to do. I lead social media campaigns, I can write articles, I can write posts, about menstruation. And actually, these stories were impactful in one way or another, and even to other journalists that have come across within the Kenyan perspective, uh, within the Kenyan uh, as a nation. Actually, they uh, most of them use real voices from the ground, from the society. It is actually really, when you see something that is really happening closer to you, something that is really within your society is being mentioned in the media, it is being covered in the media. You feel like, this is now the topic that we should be talking about. Another thing is inspired conversations, advocacy and policy attention. We need to advocate, and through this, I think actually we have made a step, and these stories have really been impactful, you know when you see organizations, NGO sharing these experiences, because when you come to the Kenyan perspective, uh, really NGOs have been really working hard towards dignified menstruation, even more than what the government is doing. Because actually, when I link it to the government only participates in providing sanitary towels to schoolgirls. But what about the women? But through this, through the media, through journalists, actually through these social media campaigns, they have been able, to make it look it to be impactful through their stories and the way they are sharing, humanize the issue, connected personal experiences with systematic challenges. We call upon experts from various fields. They come they come talk about dignified menstruation through TV, through the radio, through social media, and you find that actually this kind of initiatives have really brought about change, and there have been a really impact when it comes to dignified menstruation. Like earlier on, you could find that most of our girls, most of our women, they never knew something about, let's talk about the item, the menstrual cups, for example.
Mm-hmm.
But through media, women, girls have now started learning about the use of menstrual, this through the media. Because without the media, we couldn't uh, have such kind of conversation. So this really has brought an impact when it comes to dignified menstruation.
Thank you very much. Yes, definitely. Like social media, like you love them or you hate them, you can't ignore them, right? So it is definitely a
Exactly.
double-edged sword. There are many demerits when it comes to social media, when it comes to the how it can also derail the narrative. But again, it is definitely a powerful platform, and social media campaigns are definitely way to go forward, especially when the traditional media, they are holding back and they are in a way trying to reinforce stereotypes. I think even from an individual level, just like you talked about, like sharing a post, sharing a picture, video, interviewing somebody, like in your personal capacity, telling the stories, setting the narratives, that definitely brings us closer to towards institutionalizing or towards a mainstreaming dignified menstruation, right? So before we move forward, I want to ask if our participants, if you have any questions to Derek. And on the chat, I can already see a question from Kriti Vuzu. Thank you, Kriti, for joining in. And she's from Nepal and she has been working on this sector. She says, I think we have covered most the first part of the question. So, Derek, I will jump into the next question. So, Kursi asks, how is dignified menstruation understood, and how does it differ from menstrual health and hygiene? What is the difference between dignified menstruation and, or simply talking about menstrual health and hygiene? Derek, what do you think? And also, meanwhile, if you have more questions, so please feel free. You can directly ask the question and then we can go towards the final question. Over to you, Derek.
Okay, thank you so much. There's actually a contrast or a difference when you talk about menstruation and dignified menstruation. Um, this conversation about dignified menstruation goes actually beyond talk about menstruation in normal circumstances like girls will have pads. Dignified menstruation goes beyond when you talk about policy,
Mm,
when we talk about infrastructure, when you talk about facilities, when you talk about I've said policy, I've said infrastructure, like provision of water,
mm,
provision of education, education.
mhm,
That's about dignified administration. We talk about uh, coming up with the products, that are, for example, reusable, rather than talking about the pads, the normal pads. So we talk about dignified menstruation, about education, we talk about
right.
policy, we talk about infrastructure, all
Mm,
those kind
mm,
of thing, rather than focusing on menstruation at all, because um, we need to move from just speaking about menstruation, but speaking about menstruation with a change,
right.
speaking about menstruation that is dignified, that really, you know, brings our girls, brings our women together in a more manner that we can really appreciate,
Mm. Yeah,
and
thank
it
you, Derek. And just,
compasses everyone.
oh,
It
yes,
brings
importantly.
everyone on.
Right. And also, when it comes to dignified menstruation, just to add up, we don't talk about the period of menstruation, but we also talk about like the complete life cycle approach, right? Right from birth to death. And even if somebody is not menstruating, how the concept around menstruation or the menstrual discrimination might affect somebody who hasn't been born yet or somebody who has already reached menopause, right? We also talk about like the complete life cycle approach. Just to add up, Kriti, do you have further question? I can see you have
Yeah,
raised your hand.
I
Yes,
just
please.
wanted to clarify my question that it's definitely about it goes beyond menstrual hygiene and it focuses on dignity, human rights, and all those things, right? But my question here to Derek is, Derek, being a Kenyan journalist, how does these issues being covered in the media there in your part of the world? Because I just last week I worked as an external for a research that it was a guy who did a research on the coverage of menstruation issues in Nepali online media. And for me, it was really difficult to make him understand as a journalist, uh, to make him understand the concept of dignified menstruation because he was going more about doing the research about how much the news of products are being, displayed in the online media like advertisement and all those things. So I just wanted to make it clear that my question is more about being a journalist. How is it being covered in Kenya, unlike it's in Nepal? Like in Nepal, the concept of dignified menstruation is gaining attention recently. So that was my part of the question.
Okay, thank you for the clarification, Preeti. Yes, Derek, do you want to share more of Kenyan experience on that regard when it comes to coverage of stories around menstruation?
All right. Thank you so much question. Uh, Actually, when it comes to the Kenyan angle, the way Kenyans journalists are actually treating this kind of information, this conversation about dignified. Actually, in Kenya right now, journalists are promoting dignified menstruation by reporting on menstruation as a matter of health, education, and gender equality, without forgetting or without leaving behind a human right, rather than treating it at a taboo or a charity issue. When you talk about centering the voice of those with lived experiences, um, journalists actually currently are allowing girls, women, and others who menstruate to tell their own stories with the informed consent, respect to their privacy. Number one. That's why I told you that when we bring uh, um, those who are involved and even those who are not involved to speak about this conversation about dignified menstruation, we make this become we mirror it towards actually what is happening in the society, what is actually really happening in the society, rather than making it as an isolate case. You know, uh, this ensures reporting reflects real experiences rather than assumptions. Because when you talk about menstruation, but we don't bring those people on board, we don't bring these girls, we don't involve them, then it becomes like it's just a story, it becomes
Right.
a story. Yeah, but when we get to involve them, it becomes something that is real, something that is there, something that is normal, and we need to talk about it. Another thing is which I'll not forget, uh, uh, the conversation actually has shifted when it comes to Kenya. The conversation has shifted from charity. For example, like a politician will come who wants to distribute sanitary towels, but now it has shifted, and even people have become involved. Schools have become are getting involved. The church is getting involved. Everyone is when it comes to the health fraternities being involved. Schools are providing adequate sanitation facilities. That is either through uh, uh, the school initiatives itself or the government. You know, uh, public policies are now being implemented effectively when it comes to girls menstruation or dignified menstruation, and also the county governments allocating resources when it comes to helping uh, girls and women uh, uh, in menstruation, and it has become an health issue rather than really as an issue that affects women and girls. And also, uh, we have been before facing a lot of myths and misconception about stigma, uh, but actually, journalists have really played an important role in correcting misinformation. We have seen journalists consulting medical experts to explain what actually menstruation accurately and dispel, those harmful beliefs that contribute to discrimination, you know. And so, with all these kind of initiatives, uh, has really shaped the conversation about dignified menstruation, among many others that I may not have highlighted in your case. Back to you.
Thank you very much. Yeah. And now I don't see any more questions, or is anybody interested to ask more questions? Please let me know. I'll give you like 1 more minute because we are also moving towards the end. If not, then again, I would like to ask during the final question. Looking ahead, what practical actions can journalists, editors, or let's say media organizations take to advance dignified menstruation and help create lasting social change that we all are looking for?
Okay, thank you so much for this question that I've been looking for Anto. Actually, there are several uh, initiatives. There are several things, key issues that we can put in to ensure that we advance this conversation, we advance this topic, and help create a long-lasting change. Because actually, as a media person, as a journalist, I like highlighting something, then by the end of the day, I see that whatever I highlighted, whatever I shared, has actually brought change in the society. Number one, we can talk about that we need to integrate menstrual health into a regular health, education, gender, and development reporting. You know, it is
Mhm.
not only this one should be done during awareness days. No, this one should be like a daily conversation. It should not be We should not be waiting a specific day. We are celebrating for example mental health day so that we bring such kind of conversation. No, this one
Mm.
should be a regular health conversation, education conversation, gender, and we report it on a daily basis. This thing, when we talk about this, it will make us to feel that this is a normal issue that we need to talk about it. Number one, another thing we talk about, journalists should be trained on mental health, gender sensitive reporting, and inclusive language, of which I'm happy that when it comes to the Media Council of Kenya has been trying to advocate, to talk about mental health, uh, and more so dignified menstruation. Uh, I think I can really appreciate this so much. Another thing is develop, editorial guidelines that discourage stigmatizing language and, stereotypes, you know. We also diversify sources by including healthcare professionals because we cannot rely on one source to obtain the information really intended about dignified menstruation. We need to source, uh, different perspectives, different ideas, and we can only include several professionals in our society. Let us include healthcare professionals, let us include researchers,
Mm.
advocates, policymakers, people with lived experiences. They will help us, make advance this conversation towards something that can create a long lasting impact. And
Right.
another thing is we should also ensure newsroom uh, themselves have inclusive workplace policies that support menstruating employees. We should it should not be something that is shaming, you know. It is something that is normal, and we should also make it be normal within ourselves.
Right.
And lastly, that partnership is very important. Uh, the media and everyone, we should ensure that we partner with civil society and researchers to improve accuracy of reporting
Mm.
when it comes to dignified menstruation. And through this, we'll be creating a long-lasting impact when it comes to dignified menstruation.
Thank you, Derek. Well, we are towards the end, but we have two questions. So, without taking much time, because I'm sure we can talk about these two important questions for longer. Just could you please be very brief and try to answer these two questions? Thank you, Israt Fatima, for this question. And her question is, you have mentioned social media campaign can make change, but in rural or remote communities where social media and internet is not available, and even in these communities, communities are not much aware about things. Education is a major issues in those areas. Then how we can advocate people in these circumstances where there is no access to social media? Yes, Derek, can you please be brief and answer this one?
Okay, thank you so
Then we have one
much.
more question.
Uh,
Yeah.
yes, okay. Um, we find that there are some areas that is not in isolated cases. When it comes even to the Kenyan perspective of where I am, that you find that there are still, by the way, communities where you find the society is not really easy, you know, to access social media, and so such kind of platforms. But as I had spoken earlier of, is that you know, journalists should actually step out, and even not journalists. That's why I've said before you asked this question, that we should involve diverse people. It is only not only journalists, because we will not achieve, by the end of the day, we will not achieve without involving other people. In cases where there are no social media, in cases where there are no such kind of platforms, we now go to grassroots, you know, we now go to grassroots communication,
Mhm.
advocacy, you know, we go deep villages and start educating the society about dignified menstruation. And this will be achieved through the leaders, through the areas, you know, educators, and every kind of professional. Will When we talk about grassroots, it means that we'll reach at the door, you know, of the people, you know, we'll interact with them, we'll teach them, and through this we'll be able to achieve such kind of impact that we need. And
Mhm.
when it comes to journalists, they should not focus the urban area in the urban areas, but they should also focus on stories that comes from rural areas where there are limited access to social media, you know, to the internet and so on.
Right.
Then yes.
Yeah, and there's one more question, and this is also very interesting and important one. So this is from Nandutu Rovina, and it goes, "Thank you, Derek. From a media perspective, we ensure girls in school see period stories that make them feel proud, not ashamed. TikTok and WhatsApp are huge here in Uganda. How can young people use these platforms to promote dignified menstruation without getting censored or shamed? How can we ensure girls in school see period stories that make them feel proud, not ashamed?" Yes, Derek.
Okay, thank you so much for that. And in fact, that one, the question is very much interesting. That
Right.
the availability of the TikTok was up, even in Kenya. Actually, these platforms will help a wider perspective, because actually with the coming in of the internet, now the world has become a global village. We can interact, uh, uh, we can talk about it. So this one, especially for the young people who are using the social media platform at large, should maximize the opportunity. They can speak about dignified menstruation. When it comes, they should not fear sharing this about menstruation. So actually, they should actually use these platforms by sharing information that is true, rather than also spreading rumors, misinformation. Because actually, when it comes to the media, at some point you find that with the coming in of with the availability of social media, you find that there is a lot of rumors, there are a lot of misinformation. But because we need to create a social impact, then actually these platforms are actually good for us, when it comes to promotion of dignified menstruation. Another thing, the question: how can we ensure girls in school see period stories that make them feel proud and not ashamed? When it comes, and this one I've seen it before. Teachers, especially when it comes to in school, teachers are very proud. They are involving the younger people. They are talking about this conversation. When you talk about the syllabus, the education system has incorporated menstrual health, menstrual hygiene, and it is part and parcel of the syllabus they cover. So when teachers get involved them involving girls in school, they see it something that is normal. They learn it not only to pass exams, but they also feel that this is part of us. This is how we are. Girls identify themselves. Adolescent girls, they can really identify themselves through such kind of conversation. Uh, so I think with that is well understood. Unless you haven't, then I can share much information concerning that.
Thank you so much. And well, that brings us towards the end of today's webinar. Thank you, Derek, for sharing your expertise and thoughtful reflections with us. And today's conversation has reminded us that media is much more than a platform. Maybe it can be social media, it can be traditional media, legacy media, we say. It definitely has power, like Derek and I, who have been talking about. It has the power to shape attitudes, challenge harmful norms. It can influence policy and inspire action. And Kenyan experience, no matter where we are from, which part of the world we are joining from, I'm sure we can relate it. There has been some inspiring stories just like the Derek shared, and I'm sure like all these small actions are very powerful, and it is motivating. At the same time, there is this big gap and there is this challenge that we have to overcome. To everyone who joined us today, thank you so much for your active participation and engagement. And we hope today's discussion has encouraged all of us. And we will continue to use our respective platforms, no matter we are journalists, researchers, and we will keep fostering this kind of informed conversation and contribute to a world where no one experiences discrimination or exclusion because of menstruation. And I'm hopeful I can see all of you in next event of Global South Coalition for Dignified Menstruation. Thank you once again and have a lovely day ahead. Thank you very much. Thank you, Derek.